My goodness, all right, welcome to another video where we talk about content. In this video, we're gonna talk about pre-eclampsia, all right? I'm gonna talk about pre-eclampsia, eclampsia, and we're gonna talk about signs and symptoms, treatment, what do you do after delivery, nursing care, all the good stuff. And listen, when it comes to the things I teach you exactly what you need to know for the NCLEX, but I don't go ahead and teach you the whole chapter from nursing school. All I teach you is what you're gonna see on the blueprint and what you're gonna see on your NCLEX, all right? So it's direct to the point, no fluff, no flex. I can sit here all day, give you a 2-hour presentation about pre-eclampsia, but that's not what we're doing here, right? It's in and out, that's the information you need. I encourage my students to do flashcards where it's easy for you to review the information, all right? So let's get going. I'm gonna share my screen here and we're gonna talk about pre-eclampsia. This is just content, all right? There's no questions whatsoever. Questions, I have other videos where we talk about case studies. I have tons of maternity, labor, and delivery case studies and questions and a free test that you can take. It is on the website, freengn.com. Please go visit that website, check it out. And if you're there already, please send that website to your friends. It will mean the world to me if you spread the word, and we try to help as many nurses as possible or nursing students as possible to become nurses and pass this NCLEX piece finally, once and for all, so that they can move on with their life, all right? So let's go. Now, characteristics of mild pre-eclampsia. If you meet, or if the patient meets all those criteria, then boom, the patient has mild pre-eclampsia. So I'm gonna go over the criteria right now, right? So it is characterized by blood pressure more than or equal 140/90, all right? It usually develops during the last 10 weeks. Sometimes you see textbooks that says after the first 20 weeks of pregnancy, and sometimes they say the last 10 weeks of pregnancy. Either or is correct, all right? So last 10 weeks of gestation or up to 48 hours post-delivery. You can see it at any time during that period, right? Now also in a 24-hour urine collection, you will see proteinuria more than 0.3 grams in 24-hour urine specimen or urine collection, all right? Weight gain more than 2 pounds per week, all right? Anytime a patient jumps, boom, 2 pounds from one week to another, you're like, hey, what's going on? Let me check your blood pressure. Boom, let us do a 24-hour urine collection and check protein, all right? Not only protein, but you're gonna check other stuff. Now with urine analysis, proteinuria is more than or equal +1. The patient will have symptoms of or she'll have signs of edema, especially around the eyes, face, and fingers. Reflexes may be normal, which is +2. I'm not sure if you watched one of my pre-eclampsia case studies. If you didn't, please go ahead to the website and watch it. We talk about reflexes, right? Reflexes, which are the knee-jerk reflexes to check if magnesium is low or not. How fast the knee, when you hit the knee with a hammer, it reflex, right? 0 means no reflex, +1, maybe normal, maybe not, it's sluggish. +2, normal reflexes. +3, hyperactive, maybe normal, maybe not. So +1, +2, +3. +2 for sure, it's normal. But +1 and +3, normal, maybe not. So you have to look at other symptoms. I talked about it on a case study. And +4 is definitely, hyperreflex with like the muscle will start twitching. We call it clonus, right? So clonus of the muscle, all right? Reflexes may be normal, +2 in mild pre-eclampsia. And central nervous system symptoms, possibly the patient might have mild headaches, slight irritability. Now, when it comes to the patellar reflex, or they call it knee-jerk reflex, right? I told you, you hammer the knee, the tendon right here just below the knee, and then you're gonna get a response. So 0, no response, always abnormal. +1, slightly, but definitely, a slight reflex, but definitely there's a response. May or may not be normal, as I said. +2, a brisk response, which is normal. +3, hyperactive response, also could be normal. You have to look at other symptoms. If the patient is having like normal walk, muscle coordination, no issues at all, then it's fine with the +3, right? But if the patient is not having coordinated muscles, there's spasm, there's stiffness, then there's an issue, right? There's a situation. +4, a repeating reflex, which is clonus, right? The leg starts twitching like this once you jerk it. That's always abnormal, right? Now, severe pre-eclampsia, we talked about the mild pre-eclampsia, right? Now, severe pre-eclampsia, it has to have all the above, which was on the previous slide, +2 of the below. So blood pressure, 160/110 or more, all right? On 2 or more occasions. So you have to take it at 2 different times, all right? Now, proteinuria, 2 to +3, +2 to +3, 2 grams in a 24-hour urine specimen or urine collection. Generalized edema, very puffy face and hands. Deep tendon reflexes are +3 or greater plus clonus, all right? So the muscle is gonna be twitching like that, right? Oliguria, all right? Oliguria is less than 100 mLs per 4 hours, right? Which is less than 25 mLs per hour. Severe headache, visual disturbances, which are blurred vision, photophobia, blind spots. Especially the periphery will start, like peripheral vision will start narrowing, all right? Enzyme elevation, those are liver enzymes. AST will start going up with epigastric pain related to liver spasms, all right? Now, signs and symptoms of preeclampsia and eclampsia. You got central nervous system, as we said, visual disturbances, headache, nausea and vomiting, hyperreflexia, convulsions, right? Seizures. Hepatic signs, you got epigastric pain. Renal signs, got oliguria, proteinuria. Fluid discharge and bleeding from the vagina. Changes in fetal movement or increased fetal heart rate, all right? So that is very common. Signs of infection, of course, chills, fever, temperature over 100.4 Fahrenheit, dysuria, which is difficulty urinating, and abdominal pain. Right. Now, when it comes to treatment for preeclampsia and eclampsia, usually those are treated with a combination of medication plus bed rest, right? What are the medication? Now, the goal of treatment is to protect the health of the mother and the baby for sure, right? So what are those medications? First, IV magnesium sulfate, all right? If you watched the case study where I talked about preeclampsia, immediately we gave the patient IV magnesium sulfate, right? So IV magnesium sulfate to treat for seizures or possible seizures. You want to prevent seizures from happening. Antihypertensives because they have high blood pressure. In our case study, the blood pressure was 190 over 110, right? And then corticosteroids to promote development of the baby's lungs before delivery. Now, of course, bed rest, strict bed rest is recommended, right? Not just bed rest, strict bed rest. All right, now the delivery, usually you wait until they're 37 and then boom, you deliver the mother, you induce the mother for delivery, right? Delivery may be necessary depending on the severity of the condition and the baby's status. Oxytocin may be used to induce labor, which most of the time, that's what you use oxytocin. Now, encourage drinking more water, IV fluids, and you've got to keep close monitoring on the patient and the baby. Of course, strict bed rest is also recommended. Now, after delivery, patient needs to be closely monitored for high blood pressure and other signs of preeclampsia after delivery. So before you discharge the patient, you've got to instruct the patient to seek medical care if any of those postpartum preeclampsia symptoms shows, right? So you've got severe headaches, vision changes, severe belly pain, nausea and vomiting, all right? So immediately, especially in the first 48 hours, they need to seek help. They probably need magnesium, or they should be IV magnesium, or they should be on PO magnesium pills for maintenance, right? So that concludes our content episode for preeclampsia and eclampsia. I always tell my students, it's not about who studies more, because we're not about textbooks. We are about the exact topics and the exact information that you will see on your NCLEX, nothing more, nothing less. And that's why we have 27,000 students who pass with our program, because we give you direct information with no confusion. You see how the presentation was? Super easy, super simple. It's not complicated, because I took all the complex stuff and I broke it down into a 5th grader language so that you can understand it, and I can deliver it. And that's how we teach content, because it's easy to memorize. And then if you make flashcards and you flip those flashcards during the day, then boom, it's easy to memorize. Now with our students, we have digital flashcards where they click on the flashcard, they see the question, they click on the flashcard, it flips, they see the answer, which is an amazing tool. Everything from their phone, on the app, on their account, and that's how we do it. All right, listen, if you got any value, again, I say it over and over again, because our mission in our company, we have 16 coaches on the team. We have 48,000 students on the program, and our mission is to solve the nursing shortage in the United States. And you can help us solve that shortage by you passing your NCLEX, all right? Once you pass your NCLEX, you will help us fulfill our mission, because our mission is to have more of you in the workforce working with those patient population, because at the end of the day, we don't want that high nurse to patient ratio, 1:5, 1:6, because it's really impossible for you to deliver patient care on time if you are working 1:5, 1:6, because everybody has medication at 9, everybody has a procedure at 9, everybody wants to eat breakfast at 9. Like, it's insane, right? And if you have complicated patients like this patient, where she's having preeclampsia and she's having high blood pressure, she's having headache, and she's having visual disturbances, and you need to deliver care for that patient, guess what? You're gonna put all other patients on hold, or you're gonna talk to your buddy and try to delegate other tasks to your buddy. But guess what? Your buddy also has 5 patients, which is insane, all right? So we want you to pass, we want your friends to pass, we want as many nursing students to pass, because we need that nurse to patient ratio to go from 1:5, 1:6 to 1:1 or 1:2. That's ideally what needs to happen, all right? Love your face. I can't wait to see you on another content episode where we talk about something else, all right? Let's go.